Imagine someone, let's call her Sarah, feels fine for years, no cough, nothing really alarming. But then maybe a subtle ache starts, something persistent. And by the time she sees a doctor, gets the scans, the news is devastating. Stage 4 lung cancer. Now, this isn't just hypothetical. It's a shocking reality. Nearly half, think about that, half of all lung cancer patients get their diagnosis at this advanced stage. So today on Deep Dive, we're going to cut through the noise. We're exploring a really groundbreaking AI solution that seems to be dramatically changing how we detect this disease. We want to understand how this tech works, its real-world impact, and what it means for the future. We're drawing heavily from a recent press release about Qure.ai's QXR system.
And it's absolutely critical we do. Because with lung cancer, every single minute counts. Sarah's story, unfortunately, it's far too common. Our traditional ways of diagnosing this, they're full of bottlenecks.
Bottlenecks? Like what specific?
Well, things like subtle findings just getting missed on x-rays, severe shortages of radiologists, which creates huge backlogs. These challenges literally cost lives. So innovation here isn't just, nice to have. It's essential if we want to change outcomes for people.
Okay, let's dig into that crisis then. This late-stage diagnosis problem. You said nearly half are diagnosed at stage 4. That number is just staggering. What does that actually mean for a patient?
It means the difference between, frankly, life and death in many cases.
Yeah.
See, if you catch lung cancer early, stage 1, the 5-year survival rate, it can be around 60%. That's, a real fighting chance.
60%, okay.
But by stage 4, that number just plummets. It's heartbreaking, down to approximately 5%. 5%.
Wow, only 5.
So a late diagnosis means treatment options become really limited. They're often much more aggressive, much harder on the patient. And the prognosis, it becomes significantly grimmer. It's not just the statistic. It's lost time, lost futures. It's families facing agonizing choices.
That's, a huge difference, a tragic gap. But why? Why does this keep happening? With all our medical tech, why are so many diagnoses still coming so late?
It's complex. There isn't one single reason. It's more like several factors working together against early detection. First, and this is maybe the most insidious part, early-stage lung cancer often has no noticeable symptoms.
Right, the silent killer aspect.
Exactly. You just don't feel sick. Not until the disease is quite advanced.
Yeah.
Second, even if someone does get a chest x-ray, maybe for another reason, those tiny early signs, small nodules, subtle abnormalities, maybe less than a centimeter, they can be incredibly hard to spot.
Even for experts.
Even for highly experienced radiologists. Think about it. They're looking at hundreds, maybe thousands of images, trying to find a tiny, faint shadow in a complex picture hour after hour. Human eyes, human brains, they have limits, especially under pressure with heavy workloads. It's a huge cognitive burden.
Okay, so the disease is sneaky, and it's hard to spot early on an X-ray. What else?
Then you layer on the healthcare system itself. Workflow inefficiencies, for one. And a big one, a global shortage of radiologists. This leads to massive backlogs in reading scans, communication delays between, say, the radiologist, the primary doctor, the specialist, that can add weeks.
Weeks just waiting for results or referrals.
Or even months.
Weeks, sometimes.
And think about the impact of things like the COVID-19 pandemic.
Yeah.
That didn't just create its own crisis. It massively exacerbated these existing backlogs. Some places are still dealing with that fallout, all this lost time, this precious time, as the release calls it, between the image being taken and a definitive diagnosis. It directly means poorer outcomes, more aggressive treatments needed. And the economic burden is huge too. Late-stage treatment can cost hundreds of thousands more. And this isn't just a problem in one country. These bottlenecks are everywhere, even in wealthy nations.
Okay, so a silent disease, subtle signs, human limits, system log jams. It does paint a pretty bleak picture, but that's where the hope comes in, right? This is where Qure.ai's QXR system enters the picture. You said it's an AI-powered chest X-ray analysis system. Sounds like a potential game changer. What's the basic idea?
The basic idea is using sophisticated AI, specifically deep learning, to augment what humans can do. QXR is designed to analyze chest X-rays incredibly fast and with very high accuracy. It's not just about speed, though. It's about performing a comprehensive, rapid interpretation that can catch things the human eye might miss or flag things much earlier.
So how does it do that? What's actually happening inside the machine, so to speak, when it gets an X-ray?
It uses something called convolutional neural networks, or CNNs. Think of it like this. You teach a computer to recognize, say, a cat by showing it millions of pictures of cats. CNNs learn similarly, but with X-rays. They're trained on vast data sets, millions of annotated images, to recognize incredibly subtle patterns, textures, densities that indicate potential problems like lung nodules. It's like giving the system a kind of intuition built from analyzing far more images than any single human ever could. So when a standard digital chest X-ray is fed into QXR, it processes it, get this, in under 60 seconds.
Less than a minute.
Less than a minute. But here's what's really powerful. It's not just looking for one thing. It's comprehensive. It simultaneously evaluates up to 29 different health markers.
29? Like what?
Things like tuberculosis, pneumonia, pleural effusions, even signs of cardiac issues, and of course, lung nodules. For the nodules, it doesn't just say nodule here. It gives detailed characterization. Automatic detection, yes, but also precise location, size measurement, down to submillimeter precision. It analyzes shape, margins, density, all the critical details clinicians need.
And it learns.
Exactly. It has a feedback loop. When radiologists review the AI findings and make corrections, or when diagnoses are confirmed later, that information is fed back in. The algorithms continuously improve. And crucially, it's designed to integrate smoothly with existing hospital systems, the PCS and RIS systems hospitals already use to manage images and patient data. So it fits into the workflow.
Okay. Under a minute, 29 markers, detailed analysis, continuous learning, fits the workflow. It sounds almost too good to be true on paper, but taking something from the lab to the real clinic is always the big hurdle. How has QXR actually proven itself? Has it got regulatory nods?
Absolutely, and that's key. Qure.ai achieved a major milestone with recent FDA clearance for its QXR-LN system. That's the part specifically for lung nodule detection. That FDA clearance isn't just a technicality. It's a rigorous validation of its safety and effectiveness for clinical use.
Yeah.
That's critical for hospitals to actually adopt it.
Right. You need that official stamp. What about studies? Does the data back it up?
Yes. Multiple independent studies have looked at QXR's performance, and they consistently show sensitivity and specificity, basically, how well it detects nodules and avoids false alarms that meet or even exceed human performance. And this is especially true for those smaller nodules, under 10 millimeter. The ones most likely to be early cancers, and also the ones most likely to be missed by the human eye.
So it's good at catching the really subtle stuff.
Exactly. And another key thing is consistency. Human accuracy can fluctuate. Fatigue, workload, distractions. AI doesn't have those issues. It performs the same analysis every time. It's like a hyper-vigilant second reader that never gets tired.
Okay, consistency is huge. Any real-world examples of it making a difference?
Yes, the press release highlights its implementation at NHS Glasgow in Scotland. They integrated QXR into their existing radiology workflows across multiple sites, and the results they report are pretty dramatic. Potential nodules flagged by the AI within minutes of the X-ray being taken. Minutes. Allowing for immediate triage. So patients who need urgent follow-up get identified right away. They found the time from that initial X-ray to getting a specialist referral dropped from weeks down to days.
Weeks to days. That's incredible.
It means patients are starting treatment weeks earlier than they otherwise might have. Professor David Lowe at the University of Glasgow, who's involved, sums it up well. He talks about not just improved efficiency, but greater diagnostic equity and compressing that weeks-long process into hours or days.
Weeks to days. Just imagine that difference for a patient waiting anxiously. So let's break down these benefits clearly for our listener. Beyond just speed, what are the core advantages this AI brings?
Okay, I think we can boil it down to about 5 key advantages that really change the game. First, and maybe most importantly, it's the identification of those tiny nodules that even experts can miss. As we said, AI excels at spotting abnormalities under 6 millimeters, often the earliest sign of cancer. Some studies showed QXR found up to 30% more of these small nodules compared to radiologists reviewing the same scans. It's catching cancer at its very earliest, most treatable stage.
Okay, finding the almost invisible. What's second?
Second is that dramatic reduction in diagnostic time. We talked about weeks to days. That sub-minute analysis allows for rapid triage, potentially same-day CT scans if needed. It just cuts out huge chunks of waiting time, which reduces patient anxiety and gets treatment started faster.
Right. Speed matters immensely here. Third
is improved accuracy with consistent results. No variability due to fatigue or workload. It's a reliable safety net, ensuring every X-ray gets that same high level of scrutiny, reducing the chance of missed findings. It standardizes quality.
A reliable digital safety net. I like that.
Fourth is something really important for the healthcare system itself. Reduced radiologist workload and burnout. Radiologists are under immense pressure. This AI doesn't replace them. It augments them. It handles the initial screening, flags the concerning cases, so radiologists can focus their expertise on the complex diagnoses, on clinical judgment. It makes their job more manageable and, hopefully, more sustainable.
So it frees up the experts to be experts. Makes sense. And
Fifth is cost savings. Early diagnosis almost always means less intensive, less invasive, and therefore cheaper treatment down the line. Plus, the workflow efficiencies mean better use of expensive scanners and specialist time. It helps make high-quality care more financially sustainable and potentially more accessible.
Okay, so finds tiny nodules, slashes waiting times, boosts accuracy and consistency, reduces burnout, and saves money. That's a powerful combination. This sounds transformative for today, but what about tomorrow? Where did the experts quoted in the release see this heading? What's next for AI in cancer care?
They're very optimistic. Professor Lowe from Glasgow really emphasizes this idea of diagnostic equity. He sees AI as a way to provide consistent, high-quality analysis everywhere, regardless of location or resources. Imagine eliminating those disparities where your quality of diagnosis depends on which hospital you go to. AI could level that playing field, from big city centers to remote clinics.
That's a huge potential impact. What else?
Dr. Vishesh Mehta, a lung specialist, mentioned he's excited about the continuous learning aspect. He predicts future AI won't just detect nodules, but offer predictive insights, like based on subtle features, predicting if a nodule is likely benign or malignant, maybe even how it might behave over time.
Wow, so it could help decide who needs a biopsy and who can just be monitored. Exactly. Potentially reducing unnecessary invasive procedures, which carry risks and cause anxiety, while fast-tracking those who really need intervention. Looking further out, we can anticipate AI incorporating more data, not just images, but maybe patient history, genetics, environmental factors, for even more personalized risk assessment. We'll likely see multimodal AI combining insights from X-rays, CT scans, maybe blood tests, and a big push will be expanding this into rural and underserved areas globally, using AI to bring expert-level analysis where specialists are scarce.
So the goal is a future where early, accurate lung cancer detection isn't just a hope, but a widespread, accessible reality for everyone. We've covered a lot today, from the grim reality of late-stage lung cancer diagnosis through to exploring this really revolutionary AI solution, Qure.ai's QXR, and getting a glimpse of the future it promises. It seems clear that technology like this isn't just another tool. It feels like a fundamental shift in how we fight one of our deadliest diseases. It could mean stories like Sarah's have a much more hopeful ending in the future.
Oh, absolutely. And it leaves you with a fascinating thought, doesn't it? How this collaboration between humans and AI fundamentally changes technology's role in medicine. It's not about replacement, it's about augmentation, creating an essential partner to improve health outcomes. So the question to ponder is, what other areas of medicine facing similar challenges could be transformed next by this kind of intelligent augmentation, bringing that expert analysis wherever it's most needed?